See, Jennifer, Bonnie, Casey, absolutely the answer is sitting high folars is going to facilitate breathing. You're also going to reduce venous return. And it's kind of the opposite when you're laying flat or laying on your left side, like flat. You're going to actually increase that demand and increase the heart's workload. So we definitely don't want that to happen if we're talking about respiratory. Okay, next question. A pregnant woman arrives in the emergency department with abrupto placentae. Does anyone remember what that is? Where the placenta rips from the uterine wall. Nurse Ness knows. Yeah, she has asthma. Yeah, you just naturally want to sit all the way up, right? So her placenta just ripped from the wall of her uterus. She's pretty late in the game. She's 34 weeks gestation. She's at risk for which of the following blood diacrises? Diacrises is just a fancy word to say like disorder. So what is she at risk for? So we've got heparin-associated